The South African Health Products Regulatory Authority has approved the use of the Johnson & Johnson second dose vaccine as a booster jab. Now, the announcement of this implementation and the details have been made by the Department of Health yesterday, and it follows the approval of the Pfizer vaccine as a booster shot for its 2 initial doses as well. So to explore this further and to just give us clarity on what all of this means, we joined via Zoom now by the Deputy Director General in the Department of Health, Dr. Nicholas Crisp. Dr. Crisp, thank you so much for your time. Welcome to Morning Live.
Good morning, Sakina, and good morning to all the viewers.
Dr. Crisp, let's just start with some clarification in terms of the booster jabs and who exactly qualifies for it at this point in time.
Okay, thanks very much, Sakina. So I think there's lots of confusion about words and terms and things. So maybe just to get that sorted is that we administer what's called a primary vaccination schedule. And in the case of Johnson & Johnson, it has been a single vaccine dose. And that is the primary schedule. For Pfizer, it has been 2 doses, 42 days apart, and that's the primary schedule. And then at a point somewhere along the line, our immunity reduces for various reasons, and we need to get additional stimulation, and our bodies then make more immunity to that stimulation. And that's what the booster dose does. It stimulates our immune system so that we boost our immunity and therefore can resist further infection. So where we are at the moment is that some time ago there was approval given by the regulator, SABC, that they had received an application from Pfizer to administer booster doses after 6 months after the primary schedule. So 6 months from the second of the 2 primary doses. And that comes up on the 28th of December. And people who were vaccinated 6 months ago begin to qualify for that booster. And then in this past week, the application that was made by Johnson & Johnson for a booster for their vaccine was also approved. And that, remember that Johnson & Johnson is a single dose, not a double dose. And their the period at which they boosted is 2 months, anything between 2 and 6 months after the primary vaccination. And that means that from last night, when we switched on the system, people who got 1 dose of Johnson & Johnson may now go to a vaccination site and get a second dose, which is now a booster dose.
So just in terms of that, for those who received the single-dose Johnson & Johnson vaccine, do they necessarily have to get a Johnson & Johnson booster shot? And similarly, for those who received the 2-dose Pfizer, should they go for the Pfizer, or how does it work?
Yes, thanks very much. So at this stage, that's what you'll hear the words being used as homologous and heterologous. Big words, but basically means homologous means you get the same vaccine that you were given before. They're made differently and they are different products. So at this stage, what is registered is for, and what is in use and what the system is programmed to do is to boost with the same vaccine that you got before. So if you had a Pfizer before, then from the 28th, you can go and get a Pfizer, provided your 6-month period is up. And from today, you can go and get a Johnson & Johnson. Now, SABC did authorize the application for a Johnson & Johnson to be given as a booster to a Pfizer vaccine. But we have not included that in the schedule in the department yet. We will wait until we've got more clarity on all of the mixing. And that matter is on the agenda for the Vaccine Ministerial Advisory Committee's meeting in January. And we'll wait until we get clarification from them on this mixing and matching.
But at the moment, no mixing and matching. You should go and get whatever you got initially.
That's it. Thank you.
All right. So just in terms of where to get it, the rollout, as it were, and we do know there were lots of pop-up centers. Do you go through the process again of registering on the EVDS system, or how does it work now, Dr. Crisp?
Okay, Sakina, so now you're already registered. We know about you. Your health records are in the EVDS system. And all that will happen is the system will measure the date. It will look at your ID number. when you go for your vaccination, it will look at the date and it will check whether you've had your, in the case of a Johnson & Johnson, the 60-day gap. And if you have, it will say we can record a new vaccination. That's it. So unfortunately, quite a lot of sites are either closed or reduced functionality now because I understand Christmas is coming up tomorrow or quite soon. So people are resting. A number of people have already gone away on leave, and the whole vaccination program is a little bit slowed down as a result of that. But there are sites that are available, and people can get vaccinations done at those open sites.
And just to that point, can you go to any vaccination site? Because initially during the registration process, of course, you had to indicate your address where you lived, and you chose a center that was closest to you. So now are you able to just go anywhere and get your booster shot?
Yeah, you can go anywhere. We know about you. We know where you live, so your record is on the system. The EVDS is a patient record system. It's where we keep your health record. So now that you are known and your previous vaccination history is known, if you're on holiday and you happen to be at a site where you're able to get the vaccination and it's open and there is vaccine available, then by all means get vaccinated at that site.
So lots of talk at this point, Dr. Crisp, now that the booster shots are coming into play, about, once again, the efficacy of the vaccines. And of course, the detractors would say, you see, we told you, now you have to keep getting these shots because it's not effective. So let's talk about that. And you did touch on it. But again, the effectiveness, the efficacy of these vaccines in actually averting serious illness and death.
Yeah, Sakina, so we know from the evidence that vaccination is not 100% foolproof. We know that it does not 100% prevent infection, but we do know very clearly that it prevents severe infection. So right now, sitting in the hospitals, more than 80% and up to 90% of patients who are hospitalized for COVID have not been vaccinated. So it's a small percentage of people who have been vaccinated who end up still being hospitalized. And in many cases, those people are hospitalized because they've only had partial vaccination or that they've got other serious illness and the COVID has just been the tipping point for them. So if you are not vaccinated, your chances of getting a more severe infection and ending up with, in hospital or with intensive care units is far higher. So the confusing thing, I think, is that there are a lot of studies that are being done around the world. Most of them are laboratory-based studies, and they're small numbers that report on the antibody response. But we don't only have antibodies response in our immune systems. We have cellular immunity as well. You would have heard in the media the scientists and doctors talking about killer T cells and T cells and so forth. Never mind the details of how that works, but that's another protective mechanism. And what we seem to see is that long-term durability of the cellular immunity is stimulated by the vaccines well, very, very well. And that is what is protecting us. But like with many vaccine preventable diseases, you do need to get a reminder of the protein of the virus, and that's what we call the booster. So you'll remember as children, you got several doses of various vaccines and sometimes booster doses. And in the past, we always used to give tetanus booster doses every 10 years or so. So every vaccine is different and our bodies respond differently. And right now, what we know about this particular disease and these vaccines is what we are doing with these booster doses.
Dr. Crisp, we're talking booster shots now, but in terms of the overall vaccination drive for the nation, where are we sitting at right now?
Yeah, Sakina, it's been disappointing, especially the last month or so, where the numbers have reduced dramatically. And I saw yesterday was, again, a very disappointing day. I suppose it's to be expected as people are now moving around and going on holiday. But we have done 27.5 million doses of vaccine, and there are about 17 million people who have been vaccinated. So the good news, although we haven't managed to reach the 70% of adults that we would have liked to have reached by this time of the year, the good news is that we have reached large numbers of older people, and we know that the older people are more vulnerable. So in parts of the country, like in Limpopo and parts of the Eastern Cape rural areas, that we've been bragging for some time that they are over 75% of that population is vaccinated. And that's really good news, because it means that they will not end up in hospital for Christmas and New Year, and they won't clog up the system, and less people are likely to die as a result of that. So it's a little bit patchy. It's younger people who are not as well vaccinated, and we are seeing that also in the figures of the number of younger people who are sick and who are ending up being admitted. It's higher now than it was in the previous waves, and the concentration of admissions seems to be between 20 and 40 years of age, which in a way reflects also our vaccination coverage.
What about younger children, Dr. Crisp? Because there obviously was some concern about this in administering it to children. What are the statistics there? And also, just in terms of what the picture is that has emerged and how children have responded to the vaccine?
Yes, Kena, thanks. So, of course, that wasn't the major drive. So I think we'll pick that up in the new year. But there have been around 900,000, let me call them adolescents rather than children, between the ages of 12 and 17 who have been vaccinated. And that's obviously with Pfizer vaccine, because Johnson & Johnson is not registered for use in children. So those adolescents are partially protected. You will recall that when we started, we were only doing a single dose. We are now do have the go-ahead and the confidence from our vaccine ministerial advisory committee that the second dose is safe and doesn't have the severe side effects to the extent that it was originally anticipated or thought in the international space. So we are now vaccinating adolescents with 2 doses of Pfizer vaccine, 42 days apart, and they are coming. It is mostly adolescents who are traveling and who are going to universities and moving abroad and so on, who have come in large numbers. But in the new year, I'm sure that that younger group of people will start coming more for vaccination.
And yeah, that does seem to make sense. And we saw in Nigeria, for example, Dr. Crisp, where the vaccines had to basically be thrown out because it expired and people just not coming forward to vaccinate. What's our situation here, given that, we're also kind of struggling, as you said, to get younger people, for example, to come out and vaccinate? Much to do there on that front? Are we having to throw away some of our vaccines?
So in the central storage of vaccines, we store Pfizer vaccine at minus 70 degrees and we store Johnson & Johnson at minus 20 degrees in the central storage. And that's where the bulk of our vaccines are. I think it's been quite widely reported in the media, even by yourselves, that we had to defer some deliveries. And the reason we do that is to try and push out the expiry date, because it's from the date of manufacture that you, provided you keep it under the proper storage conditions, and then you are able to keep it for longer periods of time. Our first vaccines that start to expire, and it's relatively small doses, like 1.5 million doses, is in March next year. So as long as we've used that 1.5 million doses by March next year, we don't run the risk of anything expiring. The Johnson & Johnson is a far more stable vaccine, and its expiry date is much longer. So it starts to expire in 2023. So we're not particularly concerned about expiries of centrally stored stock. Once you thaw the stock and distribute it into the distribution network for administration, then the expiry date is reduced. And that's where people have to watch that they don't over order and they don't have too much out of the central store at any period of time. Because once that happens, of course, it's much more difficult to anticipate how you're going to use it. And it is possible that some of that stock gets destroyed. At the moment, we lose about 1% of our vaccine to wastage.
So just a final message from your side, Dr. Crisp, as we move into the festive season proper with Christmas tomorrow and, of course, next week, New Year. What message would you like to send out to the South African public with regard to the pandemic and what we can do?
Yeah, thanks, Sakina. I think that there are a few messages. The one is that COVID keeps us guessing. Right now, we've got Omicron variants. We don't know what the next variant will be. We don't know when to expect it. This one has behaved very differently from the previous variants. So I think that the message must be, don't let your guard down. Expect the unexpected. Wear your mask. We know that that does prevent us from spreading the disease. Keep in ventilated areas, stay away from large crowds, and get vaccinated. And the combination of these various interventions is what makes us all safe. And the more of us who are protected and the more of us who are vaccinated, the quicker we are likely to get on top of it.
Dr. Crisp, Merry Christmas to you and wishing you well over this festive period. Thanks so much for speaking to us here on Morning Live. And
Thank you.
That was the Deputy Director General, Dr. Nicholas Crisp, and he's been speaking to us about recent announcement of SABC's approval of the J&J vaccine booster dose and that for Pfizer as well.